Thursday to you. We are so excited today to continue our conversation about children, migraine, and school. And I am so honored to introduce to you Dr. Paige Kalika. Did I say it? I said it right, right?
Right.
Yay! I'm never embarrassed to make sure I say people's name right. I want to honor that. So, um, Dr. Kalika, thank you for joining us. I can't imagine how busy you are. We've been so thrilled with this series on talking about children migraine in schools, and I'm so excited you're here too. Specifically, tell people a little bit about your background, and so they know why we brought you here.
Okay. And I'm just so excited to be here. It's such an important topic. And this is something that, I deal with every day. And, we just want to make our kids' lives better. And this is such a big part of it. So I am a pediatric neurologist at the University of Miami. I did my training up in New York and New Jersey. And then I moved down here because sometimes you just want to have some palm trees around you. I practice general pediatric neurology, but I am very fortunate because at the University of Miami, we have an amazing adult headache division with our amazing chief, Dr. Tisha Monteith. And Dr. Monteith decided that she wanted someone to do pediatric headache. And I said, oh, I like headache. That's fine. And before you know it, all of a sudden I'm headache certified and I'm part of the headache training program. And it's wonderful. It's such rewarding, meaningful work. And, I just love these kids. We want to make everything better for them. And we can't always make it better, but we can help. And
Yeah.
there's so much hope, especially now. There's so many new treatments and options. So there's so much we can do to help.
Yeah. Well, I love that. And I know on behalf of the parents in your area, thank you for seeing the need in this space. Dr. Monteith, we love, and I can imagine her doing that and saying, "Hey, we need someone in the peds side." With school being back in full force, what are some of the symptoms that you may have this time of year? Parents come into you that actually ends up being migraine.
Okay, well, the easy one is they come in and they say, yeah, my kid's complaining of headaches a whole bunch. I'm like, oh, okay, all right, we're having attacks here. So that's the obvious one. It doesn't take much of a neurologist to say, okay, oh, that's probably a headache when someone is saying, yeah, it hurts right here. But
Mhm.
sometimes we have our younger kids, or sometimes we also have our kids who have difficulty with communication for various reasons. Maybe they have autism or something else going on where they can't always communicate what's going on. So when we have people who can't, say, oh, yes, it hurts right here, and the light bothers me, and nose bothers me, and smells make me want to throw up, then sometimes we have to use our detective skills. We have to, be a little bit of Sherlock Holmes. So
Yeah.
we say, okay, well, what's happening? They say, oh, well, he's not acting right. Oh, what's wrong? Oh, he's crying a lot, or he can't tell us what's wrong, but he's rubbing his head and he doesn't want to watch tablet or play video games. I'm like, really? We don't want to, watch TV or use the tablet or play video game. Those are signs of light sensitivity. And of
Mm,
course, it's like, oh, yes, he goes outside and he covers his eyes and starts to cry. I'm like, okay, that's a pretty good sign also.
yeah.
So
Yeah.
if you have, I'm going to say a kid, but it could also be a person, an adult, because we have adults with communication difficulties for many reasons. If we have someone who's looking uncomfortable, they're rubbing their head, they're rubbing their eyes, it looks like they're bothered by the light, they're covering their ears, they're really bothered by noise. You might want to think, could this be a migraine attack? Could there be something else going on? They're not doing this just to annoy me. No,
Yeah.
they're responding to something that's bothering them.
Yeah,
So
I think that's so remarkable because one of the things we talk about all the time is that it's more than a headache. It's not that, you don't just have a pain and they're like, oh, it's like a migraine. What are there some things other things that you can differentiate? Let's say the child only has the head pain. Does that become difficult then to decide if it's just a headache or if they could possibly be diagnosed with migraine?
it's hard because if we look at our criteria, they're a little bit different than pediatrics. In the adult world, you have to have a headache attack for 4 hours. It can be 2 hours in pediatrics. And I have to say, it's not always even 2 hours. Sometimes it's less. And that's good. I mean, of course, we want the headache attack to be as
Absolutely.
short as possible, but does it officially meet criteria? Not quite. So officially, we're supposed to say we need to either have or suspect, because again, sometimes, especially little kids, won't say the light bothers me. And even And even the bigger kids, I'll ask them, "Oh, does the light bother you?" And they'll say, "No, no." I'm like, "Oh, what do you do when you have a headache?" "Oh, I lie down and I turn off the light and I put the blanket over my head." I'm like, "So the light doesn't bother you?" "No." Mhm. So sometimes we have
Wow.
to interpret things. So, but in general, we're saying, okay, we're looking for a headache attack. We're looking for sensitivity to light and noise are the most common. Nausea and vomiting are, of course, also very common. Dizziness, which is hard for even adults to describe sometimes, so also hard for kids. So I'm like, okay, dizzy like lightheaded and woozy, or dizzy like spinning. But of course, sometimes we're just like dizzy. I don't feel right. I'm like, oh,
Right,
and that's very legitimate.
right.
And so we're looking for all those symptoms. And of course, with kids, we can also have, and this is a topic I really like to talk about, we have our, these days we're calling them the episodic syndromes that may be associated with migraine, but they used to be the periodic syndromes of childhood, and they also used to be the migraine equivalents or migraine variants. And pretty much these are these different kinds of attacks which we think are either related to migraine or actually how a migraine attack presents in usually very young kids. And
Mm,
these have different symptoms. Little kids can have, we call it benign paroxysmal torticollis, where they have a head tilt and maybe they're sensitive to noise. These are in little kids, babies. Then, toddlers may have this paroxysmal, benign paroxysmal vertigo of childhood, where they will have these very brief dizzy spells. But this is, a kid who's 18 months old. They can't say, I'm dizzy. So what do? They grab a hold of their parents. They look uncomfortable. They look pale. You say, what's wrong? And then it goes away. And you say, what happened? Bigger kids may have cyclic vomiting, where these kids will throw up, and they usually see GI and they go through a whole big workup before someone says, hey, could this be related to migraine? And then, of course, we have our
wow.
abdominal migraine, which is, this nonspecific belly pain. And sometimes the kids will also have the headache, but the belly pain is what's really bothering them. And these are in school age kids. So
Yeah.
migraine can present in this, this vast spectrum of ways and it can be different in little kids and different in big kids and different in adults. So we
I
just have to be thinking
It's
about it.
it's so complex. It's so complex because those are all some of the symptoms of school age kids in general, of catching up sickness at school, catching different sicknesses, having the belly ache and anxiety that could come with school and things like that. So I'm sure for you, it's gotta be interesting how so it sounds like it might not be one visit that you go, "Oh, it's migraine." Is that right?
Sometimes, usually the kids with the more complex presentations, like those episodic syndromes, it may take them a little while to make it to neurology, and sometimes it takes a little while to become clear. I remember there was one girl in retrospect. In retrospect, I realized what she had. I saw her when she was a toddler. She was having these funny spells where she wasn't acting right and she was off balance. And
Hmm.
I'm not sure what was going on then, but she came back to me literally 10 years later with migraine attacks. I'm like, oh, I remember
Wow.
years ago now.
Wow.
So,
That's amazing.
but most of the time, it's it is pretty clear because the majority of kids are able to say, "Yeah, my head hurts." It's like someone going boom, 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 and a lot of them are very good at describing it. When I always say, if you can't answer the essay question, I'll make it multiple choice. I'm like, okay, is it like a boom, boom pounding? Is it tight and squeezing? Is it sharp like needles, or none of the above? And usually they're able to give enough of a history that we can say, okay, this fits with the migraine picture.
Well, which one of those is the migraine picture for kiddos? I
And
know
the
that question's coming online.
Oh, okay. No, honestly, it can be any of them.
Yeah.
But the most common is that pounding feeling. And in adults, it tends to be unilateral, one side. Kids, it actually can be, it's more often bilateral, both sides. So s- some of the rules that we learn in the adult world don't really always follow through in
Yeah.
pediatrics.
Yeah.
Kids are allowed to break the rules, right?
Absolutely. So what's the first line of defense if parents come in well, actually, let me back up. When should they see a pediatric neurologist?
Oh, that's a great question because first stop should always be your pediatrician. Because I love our general pediatricians. I did most of us in pediatric neurology will do at least 2 years of pediatrics. I actually did 3 because I love it. And our general pediatricians are really capable of handling A lot of things. So a lot of times you may not need a neurologist. So you go to your pediatrician and you see what he or she has to say. Sometimes when it's really clear cut and the attacks aren't that bad and not that frequent, they'll make the recommendations. But if it's complicated, if it's strange, if these are horrible attacks that aren't responding to our over-the-counter meds, we need preventative medicine, or if you're just really, really anxious, there's no harm in coming to see a pediatric neurologist about it. We're always happy to see kids.
Yeah, that's great. That's great advice. And also, I think sometimes just that is that parent instinct of like, if the peds doctor may say something like, they'll just grow out of this, and you keep seeing it interfere with school, right? And sports and things they should be able to do. Trust that parent instinct. What is kind of the first line of defense? Like, if parents are going, gosh, what would I possibly give my child for this? What are some of the things that parents should be aware of that they could be offered as some solutions?
Okay, well, I divided into, the things I can do for you guys and the things you guys can do for yourselves. And I would say, okay, most important things are the things that you guys do. And that's all the boring stuff. What's that? Eat well, sleep well, drink lots of water. We know that migraine attacks are very much brought on by environmental factors. So physical things like, is your kid getting enough sleep? And spoiler alert, most of them are not getting enough sleep. Little kids need, like at least 10 hours of sleep. Teenagers, no matter what they tell you, need 9 hours of sleep. None of them are getting it. So we need to make sure that we're getting good, and not just enough sleep, but good quality sleep. Is your kid snoring? So I always ask about that because we have this idea that, oh, snoring, oh, that's a deep sleep. No, it's the opposite. You're waking yourself up to breathe. So what happens when we're not getting good deep sleep? All the bad stuff. These are kids going to be cranky and irritable. They may not be focusing. Sometimes they get hyper. You think that they'd be sleepy, but no, they can be hyper. And of course, they can be very headachy. So we work on sleep. And food. My teenagers don't want to eat breakfast and they don't want to eat lunch. And then they come to me and they say, yeah, I always get this headache. It's right here. And, it always happens around 2 in the afternoon. I'm like, really? Really? Tell me more about that. So, so we're not eating well. And then water, nobody's drinking enough water. And every time I say that, I start looking around because now I'm thirsty.
Yeah,
So
right.
I say this all day, every day, over and over. Eat well, sleep well, drink lots of water, cut down on our screen time before bed. I
Mm,
specifically say before bed because, well, one, we're all like this on our phones all the time, it's not great for us. But more importantly, the light from the phone messes with our circadian rhythm. So then I have to say, okay, I know you guys haven't gotten to this in school yet. Your circadian rhythm is like your body's alarm clock. It tells you when to wake up and when to go to sleep. So it's governed by the sun. That's why it's so much easier to wake up when the sun is already up. It's not just that you got more sleep, although that doesn't hurt. It's that our body got the signal. It's wake up time. So what happens is the sun is up. Our body says, okay, it's time to be awake. It's time to be awake. The sun goes down. Our body says, hey, it's time to make that melatonin. Melatonin is a hormone that helps us fall asleep. We have enough melatonin in our body. We get sleepy. We go to sleep. No, that's not what happens. This is what happens. We're staring at
mhm,
the phone.
absolutely.
We shoot that blue light into our brain. Our brain says, oh, it's daytime. Shut down the melatonin. We're not sleepy. What do we do when we're not sleepy? We stay up late on our phones. So
Yeah,
it's
yeah.
all about trying to optimize our environment. That's physical. Those are our physical stressors. We say, okay, we want to keep track. I always say, keep a headache diary. You can do this paper and pencil old school, or I know I said, put down your phone, but there are a lot of apps. Everyone asks me, what do you recommend? I'm like, ugh, they're all, I don't care what you use as long as you use something.
Yeah.
But if I'm going to recommend something, I recommend Migraine Buddy. Why? It was recommended by the American Headache Society when I was there one time. And also, it is my favorite four-letter word, free. I like free.
Yeah. Yes.
Um,
Absolutely.
so yeah, so just keep track because we want to see what are our triggers. Are there food triggers? Everyone is obsessed with the food triggers. I usually say don't cut anything out of your diet, but keep track. If you notice that you always get a headache after pizza day, I am so sorry about the pizza.
Try again, just to make sure.
So
Yes.
keep track. So we're looking for our different triggers. Are you someone who is very sensitive to smell? A lot of people with migraine disorder tend to be super duper scent sensitive. How do you know if you are? Oh, you know. You
Yeah.
say, oh, perfume makes me so sick. The smell of cigarettes gives me a headache every time. These people usually know who they are. So
Yeah.
you say,
Yeah.
okay, We need to optimize, what's going on. We need to try to reduce our triggers. And I'm like, okay, those are all the things you can do. Now it's my turn. All right, what can I do to help? So, okay, so we're talking about prevention. And our first line prevention is actually very, very low key, old school, because we like to start with the things that have the fewest side effects.
Yeah.
So I say, let's do some vitamins. And everyone gets happy because vitamins aren't medicine. We don't like medicine. Like the doctor says, take this pill. And even if it's a vitamin, it's still medicine.
Yeah.
And
Yeah.
but as parents, we have this idea that natural is better. And as a doctor, I have to say, okay, look, natural doesn't mean better. Poison ivy, lead, and bears are natural. That doesn't mean we want them to happen to us.
It's a
And
really valid point.
this feeling that it's natural, so it's no, natural is
Mm.
good. Nature's out to kill us. And then we have air conditioning, and it may be getting cooler in the rest of the country, but I'm down here in South Florida. I am not by air conditioning, so
I've lived there. It's yeah, there's no cool there.
no, no, no.
What should they look for in a vitamin? If there is there something in particular?
Yes, that's a great question. So there's no harm in just a regular multivitamin, but there are specific vitamins that have evidence for being helpful for migraine. You're always going to hear me use the word evidence and evidence-based medicine because I figure that's my job. Nobody wants to see me for my opinion on things. You want me to say, okay, look, this has been studied. This is how we think it works. And this
Yeah.
changes. This changes based on, the research going on, what we're seeing with our patients in real life. So I try to make the best recommendations based on our best, most recent
Yeah.
evidence. So what's our evidence? Um, two vitamins in particular. One, vitamin B2, not B12. I always tell them that B2, which is riboflavin. Um, very gentle, very well tolerated. The only thing I warn about is it can turn your pee orange. I have learned to warn people about this, otherwise you get really
I'm
weird phone calls.
sure. I'm sure. So vitamin B2. Okay, that's good. I'm taking notes too.
Oh, it's good stuff. And again, it's so benign. The other one, technically a mineral, not a vitamin, but close enough. Magnesium. So magnesium is also, very gentle, very benign. Good for other things. It helps with sleep. It's good for muscle cramps. It is excellent for constipation. Make sure you warn about that because you don't want to be taken by surprise. Although a lot of my kids, this is a
Yeah,
beneficial side
sure.
effect here.
Sure.
We've seen that people who take these every day tend to have fewer headaches overall. So this is always where I start. Then there's some other things that we have some mild evidence for. Enzyme CoQ10, there's some evidence for being helpful. Melatonin, I just mentioned melatonin as being, that's our sleep hormone. Well, somebody actually did a study and people who take melatonin nightly tend to have
Mm.
fewer headaches. Now, is that because the melatonin helps the headache or because the melatonin helps the sleep and the
Absolutely,
sleep
yes,
helps?
that was gonna be my next question. Now let me say this because
Yeah.
I actually have people ask sometimes, "Oh, I can take a vitamin, but my kid doesn't need to have as many veggies or what or fruits." That's not correct, right? It's not a substitute.
No, not really. I mean, okay, look, we like it when we get most of our stuff through the diet, but I will say that the doses that we need for these vitamins are not something we can do easily through the diet. So I'm like, no, no,
Sure.
no. This time, store bought is best for
Sure.
this one.
Okay. That's great. And then also there's a new medication that came out and we don't name a lot of brand names here, but it sounds like with the new medication for kiddos, there's some good stuff on the horizon. Talk about
Oh,
how hopeful are you with looking at children's medicine and migraine?
I am so excited. So we do have a variety of prescription medications that we can use for both prevention and treatment. So we have in because this is pediatrics, it's trickle down from the adult world. So pretty much things get tested out in the adult world. Then we're like, okay, we're getting more comfortable. Come on, we want it in the kids, and we start getting it, covered a little bit in the teenagers, and finally, we get to start using it in younger kids. It takes a while.
Yeah.
It's a
Yeah.
process. So you know, we have a bunch of different medications that in our arsenal that we can try, and we try to target it for different things. If we have someone who has maybe symptoms of anxiety or depression, well, a lot of our migraine preventatives started out as medications for anxiety and depression. If we have someone who also has epilepsy and seizures, a lot of our migraine medications are used for that also. A lot. So we say, okay, let's see if we can get something that's going to have, you know, good efficacy and also maybe help some other conditions or at least not
Yes.
hurt them. And but the exciting thing is now we actually have some very migraine specific medications, and that's what you were referring to. So there's this new class of medications. I say new, you know, this they've been out for several years now on the adult side, and the adult patients are loving them. They're wonderful medications. They are injections, which freaks out, well, not just kids, freaks out a lot of grown-ups too. But it's like, look, it's a once a month injection, and if you're one of those lucky people who responds,
Yeah.
your headache frequency can go way
Yeah. I
down.
know.
So I've been fighting to get it in my older teenagers, and now all of a sudden, one of them was approved 6 and up. And I am so excited. And yes, waiting to
So
hear back from
exciting.
patients who I've prescribed it for in the last month. So
So
this is
exciting.
a great time.
Yeah, I think that's so amazing, and it just kind of says we're on the right trajectory. And testing children and medications to get to this point takes so long. So that's super exciting news. Well, I know that we could talk forever, and I'm like, this has been the fastest few minutes. Is there anything else you would say, just a word of hope for parents or teenagers who are watching this, who are frustrated and they're like, it's affecting my lifestyle? Give us a message of hope before we close up.
Absolutely. And that's so important because there is hope. There always has been. But you know what? Things are so much better now than there used to be because one, there are much more effective treatments that are out there now, and there are so many more on the horizon. You know, not just pills to take, but other modalities. There's injections, which I know nobody likes shots, but look, they're really, really good for you. Come on. And also things that are not even medicine. We have these really cool neuromodulation modalities where we're kind of working with the nervous system. And we have good evidence that these can be helpful either on their own or as an adjunct to medication. There's also more awareness, more understanding that it's not just a headache. Come on, I have that headache right now and I'm fine. And not that, yeah, sure. That kind of headache is fine. Not this kind of headache. So there's more awareness, there's more empathy, I think. And I think we're just entering a much better time to be alive with a migraine disorder
Yeah.
because we have options. There is hope. We can help. So don't despair because this can steal your life, but it doesn't have to. Get
Mhm.
help. Talk to your kid's pediatrician, or if you're an adult listening, talk to your own doctor because a lot of my visits are really twofers. You know, I'm
The
I ask
parents like, "Oh, well, I'm here."
it's funny because a lot of times they're not diagnosed. They're like, "Oh, I just have normal headaches." I'm like, "Okay, what's your
Mm,
normal headache?" "Oh, well, you know, a normal headache. The light bothers me, the noise bothers me. I have to go lie down in a dark, quiet room. The room is spinning and I'm throwing a
right.
yeah,
You're like,
that's your
"That's
normal
not,"
headache."
you're like,
That
"You have
that's right.
migraine."
That's what it is. So, yeah, a lot of times
Well,
more people than one are getting diagnosed.
Well, thank you so much for all this information. And for people who are watching, last week we went live with a high school student who is thriving with migraine. She's kind of my new, like, thriving with migraine because she kept advocating. She's now just doing amazing things. But watching her, it's so refreshing because, kind of to what you said, you have to try different things. And sometimes it's a different, takes a little bit of time. But with good doctors and neurologists and headache specialists who are surrounding you, they can help you. And there is some patience that comes with it. But we just thank you so much. Thank you for being part recently of our recording that we have on our YouTube channel and our events section of our website on headache and migraine and children in school and going to school and what can you do and what rights do you have and those types of things. There's a great series we're going through with that as well. So thank you so much. I hope your day in Miami is wonderful, as I'm sure it will be. And thank you to those watching. People that want to give us a certain topic you want us to talk about, feel free to email info@americanmigrainefoundation.org. And we'll always consider those and see what people need to hear about. So, Dr. Kalika, thank you so much. And thank you to your cat back there that stayed still the entire time.
Yeah, well, I had a guest star in here. He's my baby, my Smokey baby, and thank you so much for having me. It was such
Thank
a
you.
pleasure. Happy to come back anytime.
Thank you as well.